Scarlet Park, Bubba Sparks.
Booty, 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 rockin' everywhere. Booty, 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 rockin' everywhere.
So if you're helping assist with the ultrasound for OBGYN as a medical assistant, don't get too overwhelmed. Like I said, this is one of the best procedures to kind of help out with. It's no blood involved or anything like that, so it's harmless. It's totally free. So what's up, YouTube? It's Desi and I'm back with another video, y'all. So in this video, I'm going to talk about all about ultrasounds. So if you're a dude, go ahead and swipe past this video because you may not like what I'm going to say for this video. And if you're a kid, you shouldn't even be watching this unless you're 18 or older. But however, okay, so this will be just the duties that you'll be doing as far as for medical assistant. I had did medical assistant for OBGYN for my externship. So these were a couple of the duties that we ended up doing. I definitely feel like ultrasound is kind of like a good one to kind of talk about because some people may wonder, do they help assist with ultrasound? And the question is, yes, as a medical assistant, you do help assist with ultrasound if you're working at OBGYN. So pretty much, what is an ultrasound? So an ultrasound is a test sonogram. It's a painless exam that uses sound waves to check a pregnancy or to get images of body organs. An ultrasound can give your doctor almost the same info as an x-ray, but it doesn't expose you to the harmful radiation. And we all know radiation isn't good for your body, like, at all. There are 3 types of ultrasounds. You have the pelvic, the pregnancy, and the abdominal. Each test takes about an hour. Now, usually for the ultrasound, you want to make sure that you're getting a correct and accurate reading for the baby. So, yeah, that's pretty much as accurate. So what is the medical assistant job as far as for ultrasound? So the medical assistant job is to pretty much help the nurse or physician with retrieving the images and making sure the ultrasound goes smoothly. I know in my externship, we were able to just kind of make sure we prep everything, get everything ready. We're going to be helping assist throughout the ultrasound, but the majority of the job is done by the physician or nurse, most of the physician that's helping, you know, try to get the pictures or the sound waves to kind of connect through the baby. But at the end of the day, this is going to be the job that you do as far as for a medical assistant, because you don't want to overdo your job. Like, a lot of people may get so excited, like, oh my god, I'm about to help with the ultrasound, and then they end up messing up something. So you want to make sure that you kind of just be calm and follow everything as directed. So what I had to do was, one, you want to make sure that you have the exam room table clean. The table that the patient will be laying on, you want to make sure you have that clean, and make sure that you have the stair parts in place, because like a lot of patients are kind of picky when it comes to stuff like that. You want to lay out a blue cloth, get the blue cloth ready. That'll be the cloth that you'll have all your items on to get ready as far as for the physician. So if they tell you to pass something to them, you always have it ready. You want to grab lubricant gel. The lubricant gel is to kind of help smooth things out if anything is getting inserted into the patient, or if anything just needs to kind of be smoothly to go inside of the patient. The lubricant is pretty much there to help out. You want to lay out the gloves for the physician, because like I said, you could have gloves on to pass everything to the physician, but you're not going to be the one that's doing everything. So you want to make sure that you help as far as for that. You want to lay out the probe. The probe is going to be what goes inside the woman as far as for the ultrasound. So you want to make sure that you have that covered and laid out. Usually when you're dealing with the probe, you don't want the probe to exactly go inside the patient, so you'll be having like a cloth thing over it. Like, say for instance, this is the probe. This is the cloth that you'll have over it. So it's going to be laid like that. And say for instance, this is the lubricant gel. So you'll pour the lubricant gel on there, rub that on there or whatever, and then it goes inside of the patient. So that way the probe is protected. That's what's that for. Everything is turned on for the ultrasound. So you want to make sure the machine is on, you want to make sure the light is on, you want to make sure everything is turned on. Anything that the physician may need, just make sure you have that in place. Pass all, and then the last thing for you to do, you want to pass all the items accordingly as needed. They will let you know what you need. So at the end of the day, if you're like so bummed out as far as for like, dang, I hope I don't mess up, I hope I don't pass in the wrong instrument, they're going to tell you exactly what you need. So they're like, okay, I need the lubricant. You have the lubricant ready. I need more gloves. Have the gloves ready. I always like to have extra out as far as for like tablecloths or like the little square cloth stains, gauze or something like that. I like to have those out extra, or as far as for like a cotton swab, the large cotton swab, or I like to have extra out cotton balls, because you just never know what the situation may be. They may need something extra as far as for that, so that's good as well too. And pretty much this is what's going to happen as far as for ultrasound. So you're going to lie the patient down on the examination table or bed. Pretty much they're going to be in supine position. Look that up if you're not sure of supine position, but supine position is going to be laid down. Lithotomy position is pretty much for Pap-smears, but I don't know, for ultrasound, would it be, yeah, I don't know. I'm gonna leave the position below, you guys, because I'm like, my mind is, but it's important to know that, like, with certain procedures and stuff like that, you need to know which position it's going to be and which position the patient is going to be, because that's going to be on a test. But you want to lay the patient down on an examination bed or table. You want to apply the special gel to your abdomen or pelvic area, so pretty much that'll be the lubricant. The gel is water-based, so it shouldn't mark your clothes or anything like that. I don't want anybody thinking it's going to mark anything. The gel helps with the sound waves, just to make sure that it travels properly. Okay, so there's a small wand which is called a transducer. It's put on your belly, so it's put on the part just to kind of connect the sound waves, and we're moving the transducer around to capture black and white images on the screen. So they're pretty much trying to do that. And at the end, the gel is wiped off, and then they print out your images. So pretty much, like I said, you just come in there, you lay down. Once you lay down, you know, the doctor will pretty much tell you how the procedure is going to go. They're going to stick it up you. They're going to make sure that they capture what they need to get. If they can't get it through the pelvic way, they can go on top of your stomach and kind of like capture what they need to capture on there, because it's sometimes hard. But yeah, that's pretty much how ultrasound goes. It's pretty much easy, fairly easy, a good procedure to kind of assist with. I'm not gonna lie, when dealing with OBGYN, I was quick to kind of help with the ultrasound. Like when they're like, okay, so who wants to come in here to help me out, I'll be quick to like, hey, I'll come, because I'd love just to kind of like learn and get this stuff down packed. Hopefully this be able to help you guys out. Like I said, there's plenty other procedures that was done when I was in OBGYN. This happened to be one of my favorite that I was helping out with. So yeah, if you guys have any questions or anything, leave it in the comment below. Hopefully everybody have a good one. Peace, y'all.